if there will be any hormonal imbalance,
Yeah.
does it disturb breastfeeding?
Oh yeah, see, hormones, we have two types, like hormones which are able to produce the milk, hormones which are responsible for secretion of the milk outside of the breast.
Okay.
So any disturbance in the hormones that produces the milk or that might cause any imbalance in production of the milk, like thyroid hormones, like prolactin, these hormones. Prolactin is the hormone which is responsible for production of the milk.
Okay.
And then if the patient or if the mother is having some PCOS issues or some thyroid issues, there might be some delay in production of the breast milk, as well as she might not be able to produce enough breast milk. Whereas oxytocin is a hormone which is responsible for secretion, that is pumping of the milk outside of the ducts into the nipple, so that when the baby sucks, this oxytocin is responsible for that secretion of the milk. So if there is any imbalance of the oxytocin hormone, although adequate amount of milk is being produced, it is not being supplied to the baby because of the lack of hormone. So definitely hormones play a major role in production as well as secretion of the milk.
Is there any specific thing that you have to educate the new mother about the hormonal imbalance?
Yeah, definitely thyroid, like hypothyroid patients. So they will be having issues in breast milk production. So we'll be asking the woman to check their thyroid levels even before she conceives. And later on also, during pregnancy and later on also, the hormones are being disturbed, thyroid hormones. Many women who are not hypothyroid before pregnancy, they might become hypothyroid during pregnancy. So they might land up in breastfeeding problems later on after delivery. So definitely thyroid hormones are the most important hormones that might cause imbalance in breast milk production and secretion, as well as people with diabetes and any other PCOS issues. They might have issues with the breast milk production. So we educate the women that if you are having these issues, that make sure that they were balanced during your pregnancy and lactation.
Basically, if milk is secreted but it's not coming out, or if its milk is not secreted, then what kind of physical problems a woman will face?
When milk is being produced but the baby is not able to feed properly, or the milk is not coming out of the ducts through the nipple properly, then she might land up in blocked ducts.
Blocked ducts?
Yes. The ducts, what we call them as the lactiferous ducts. They are called the milk ducts in normal terminology. If there is any stasis that milk is not coming out of the ducts, then these ducts get blocked. So what happens to the rest of the milk? It gets stasis. What we call stasis is nothing but it's just left over in the breast. It's not coming out of it. So the woman feels engorgement of the breast. She feels sharp pain in the breast. She might also land up in infection of the stasis of the milk. Like there is always milk that is being left over in the breast, and moreover there is infection into that leftover milk. So this is called mastitis in medical terminology.
Mastitis.
Infection of the breast tissue.
Please elaborate what is mastitis.
Mastitis is nothing but inflammation and infection of the breast tissue. So most commonly, it is not rare in lactation. It can occur in normal women as well, not just in lactating women. But more common in lactating women due to this issue. Like milk is getting blocked and it is not coming out properly. Milk ducts are getting blocked and the milk is not coming out. So the stasis of the milk will invite infection. So infection will lead to mastitis. If we don't intervene at this stage medically, then this might progress to an abscess. Abscess is nothing but pus formation inside the breast.